In our last episode, guys, we discussed yung mga whitening creams available in the market containing mercury and how they are very unsafe and not really good to use to whiten the underarms. Syempre, because of that, marami sa inyo nagtanong, Doc, ano naman yung pwedeng gamitin na safe na at effective pa? Well, I have a video about that which I published before on things that you can use and ingredients you can apply to your underarms to lighten it. But for this episode, ang pag-uusapan natin ngayon are in-clinic treatments that are available and safe to use for the underarms na pwedeng i-offer ng mga dermatologist sa inyo. So before we even talk about the treatments, it's very, very important to know first kung bakit nga ba nagkaka-hyperpigmentation in the underarms. And it's not just about dirt or kulang sa ligo or kulang sa sabon. There are actually multiple factors that can influence discoloration in this area. And it's important to address these because the treatments that we do may not be that effective. Now, simulan natin dun sa na-mention ko na kanina na cause. Number 1, friction. What does this mean? Ito yung, syempre, lagi tayong gumagalaw na ganyan. When we wear tight clothing, when we move our arms this way, it can cause friction which can lead to hyperpigmentation. Number 2 are hair removal practices like plucking or waxing. This can be considered kasi trauma to the skin which can lead to darkening. Number 3 are use of chemicals and ingredients on the underarm area like our antiperspirants that contain harsh ingredients like mga aluminum that can irritate other people or those containing alcohols or fragrances. Now, this may not be true for everyone, but I do know of some patients who experience irritation from these ingredients. Number 4 would be post-inflammatory hyperpigmentation. So, anytime na magkaroon tayo ng irritation, itchiness, or redness in that area, when the skin heals, it can develop hyperpigmentation. Next is acanthosis nigricans. Now, this one, guys, is something that your doctor will diagnose. It's usually thick, velvety skin that looks a little bit grayish more than brown. And it's located in areas of the skin that have folds, like your underarms, your inguinal area, sometimes even your neck. And in some patients, it's related to insulin resistance and being a little overweight. So, ito kailangan to ma-address properly para ma-resolve tong issue na to. And then finally, of course, we have genetics. So, syempre, if you have darker skin types, sometimes you're more prone to hyperpigmentation. And yung iba, talagang kahit bata pa lang sila, medyo may discoloration rin yung underarms. Now, knowing the cause of your dark underarms is very important because ito yung magdedetermine kung anong treatments yung mga gagawin sa'yo and then moving forward, ano yung mga iiwasan mo at ano yung mga gagamitin mo. When it comes to treating your dark underarms, maraming advantages when you do it in a clinic. Number 1, the treatments and procedures are medically supervised. Number 2, we use medical grade and professional formulations. And number 3, the treatment and procedures are tailored to your needs and very specific dun sa situation mo. So again, that depends on the causes of your dark underarms. In my practice, and my patients with dark underarms would know this, the first step for me is to do laser hair removal kung meron ka pang buhok. Why is that? Number 1, it's easier to do treatments on an underarm na clean and free from other things like hair. There's less friction, less chance for ingrown hair, less chance for irritation pag wala ng hair. Number 2, the pigment in the hair contributes to PIH kasi source din siya. So pag na-eliminate mo na yung hair, nababawasan yung sources of pigmentation. Then once nagawa na namin to, another treatment that I like to offer to my patients are chemical peels. So these chemical peels are medical grade formulations, meaning they come in higher concentrations and more often than not, they are a combination of a lot of exfoliants. For example, AHAs like your lactic acid, your glycolic acid can be combined with like phytic acid. So ang goal ng mga chemical peels natin are to slough off the top layer of the skin, pushing that layer that contains melanin. And through time, your skin in that area will lighten. Some of the things that we also apply combined with chemical peels are tyrosine inhibitors like your kojic acid, for example. We also use ingredients that help lighten the skin like tranexamic acid. So all of these contain higher concentrations of active ingredients that are safe when done by a trained professional. Other benefits of doing chemical peels on the underarms are smoothening. So, syempre yung mga nag-plaque na dyan, tapos medyo gumaspang ng skin nyo, it can help smoothen that area. And number 2, it can also help prepare that area for other treatments to come. For example, if you want to top up with another treatment, for example, laser treatments. Now, for chemical peels, often we recommend doing 3 to 4 treatments spaced at least 2 weeks apart. Depende na yan dun sa makikita mong results. Most patients would see a change already after 2 sessions, but it's up to you if you want to keep continuing the treatments. Now, for example, okay doc, naglighten na yung underarms ko, pero hindi pa ako satisfied kasi may konting shadow pa. And that's very common. I get a lot of patients with that kind of issue. The next step in our treatment plan would be lasers. An example of a laser that we have in the clinic is the Q-switch Nd:YAG laser. So, there are 2 types, and I'm sure yung mga laser savvy dyan, alam nyo yan. There's a nanosecond laser and there's a picosecond laser. So, ang difference ng dalawa is the pulse duration or the intensity of the mechanical effect of the laser. So, ang ginagawa ng nanosecond laser, it shatters boulders into pebbles, whereas the picosecond laser shatters them into sand. So, mas grabe yung mechanical effect ng picosecond laser. But in my clinic, we start first with the nanosecond laser because most of the time, the pigmentation can be addressed. Now, kung halimbawa hindi ka na satisfied at gusto mo ng more mechanical effect and medyo tingin mo mas grabe yung pigmentation mo, you can try and opt for the picosecond laser. But both of them work by shattering pigmentation so that they can be flushed out by the body. That's why you will need several sessions. So for this one, we normally recommend doing at least 3 to 4 sessions, again, spaced anywhere from 2 weeks, yung pinaka-shortest na yon, to 6 to 8 weeks apart. In my clinic, most of my patients come a month apart and we take photos para madodocument natin yung changes. Now, disclaimer lang guys, it's important to know that not all nano and picosecond lasers are the same, okay? So, hindi ibig sabihin this clinic offers nanosecond laser or picosecond laser, same na siya. It's very, very important to know what type of laser the clinic is offering and if it is done by someone with a lot of experience and who understands how lasers work. Kasi, hindi yan pare-pareho, guys. For example, I have patient A and I have patient B. I usually don't use the same settings on them, especially if they have different skin types. So, importante yan kasi lasers are good if they are done on the right indication, but if nagkamali ka, pwede ka rin mag-cause ng burns and even more darkening of the underarm area. In fact, just recently, I posted a video on my Instagram regarding a reaction video that I did about someone who shared her bad experience of getting burned after doing a laser hair removal treatment. So, magkaiba yun guys ha. Yung ginagamit natin na laser for hair removal is different from the laser that we use for laser whitening. So, it's very, very important to go to a clinic and a doctor with a lot of experience and knows and understands the lasers that we use. Not to mention yung clinics na walang nag-supervise na medical practitioner kasi there's nothing wrong naman with a nurse doing your treatment as long as it's really guided and supervised by a doctor. Now, for example, you're my patient and nakapag-laser hair removal na tayo, chemical peel, laser toning treatments, and maganda na yung underarms mo. Now, how do you maintain those light underarms? Syempre, very, very important yung home care treatment. So, very common na in my patients, I send them something to apply at home that's not just any kind of formulation. So, these are professional formulations that are medical grade, containing ingredients like Morus alba, kojic acid, sometimes even niacinamides, and ingredients that lighten while protecting this very delicate area. This, in combination, of course, with avoiding yung mga triggers na nag-cause ng darkening ng underarms mo, can actually further improve not only the color but also the texture of the skin on the underarms. And lastly, alam nyo na to, I'm a very big fan of combination treatments. Really, combination treatments will yield best results. Ano ibig ko sabihin? For example, you can combine laser hair removal, chemical peel, not on the same day but as a series of paired treatments. Next, pwede din naman laser toning combined with your medical formulations to treat hyperpigmentation. And lastly, occasionally, I sometimes do chemical peeling paired with LED light as an anti-inflammatory treatment, especially for those who I feel needs to use higher concentration of the chemical peel. Now, how do we determine kung anong treatment yung bagay sa'yo? Siyempre, iba-iba naman tayo ng mga cause of pigmentation and iba-iba din tayo ng budget limitations. What's important is for us to know the skin type, the depth of pigmentation or the severity of pigmentation, and of course, yung triggers. Now, for example, in my clinic, may mga patients naman na we try to calm the irritation first. For example, nalaman natin yung cause pala nung kanya is post-inflammatory hyperpigmentation from irritation. So, we remove the trigger. calm the skin, soothe it before we proceed to the next treatment. It can be chemical peel or laser hair removal. Or meron naman mga patients na, Doc, na-try ko na lahat. I've actually done other treatments in other clinics. It's still dark. I may already move on to laser toning agad, for example. So, iba-iba yan. That's why it's very, very important to consult with a dermatologist and, have an in-depth assessment of your skin in that area. And ako, I really like to take before and after photos. Kasi especially for someone who looks at his or her underarms on a regular basis, hindi mo na maaalala kung ano yung itsura niya dati and hindi natin mo-objectify yung improvement kung meron man or wala. So, very, very important to take before and after photos. And finally, itong advice na to, I always give to my patients whom I treat for dark underarms. What you do at home, what you do on a regular basis, how you care for your underarm is as important as the treatment and procedures we do in the clinic. Kasi syempre kung na-treat na natin, tapos hindi mo naman inaalagaan yung underarms mo, pwede ulit siyang bumalik dun sa dati niyang kondisyon. What am I talking about? So my tips for caring for your underarms at home is number 1, avoid natin yung friction. So again, no wearing of tight clothing and iwasan natin na parang magkiskisan yung skin natin in the underarms. Number 2 is only use ingredients on your underarms that are non-irritating. So pwede naman may konting smell, may konting fragrance, but maybe on the mild side. Number 3, yung hair practices mo. Syempre, I do encourage laser hair removal first, pero kung ayaw mo talaga, avoid na lang natin yung over-plucking and over-shaving because they can traumatize the skin and the underarms. Number 4, make sure that your skin and your underarms is moisturized to maintain the barrier. And number 5, avoid using mga scrubs and harsh ingredients and doing DIY treatments to lighten and even the skin tone on your underarms. And ito pa pala, bago ko makalimutan, please do not buy lightening creams and ingredients that you just find anywhere, especially the ones containing mercury. So yung mga hindi pa nakapanood sa inyo ng episode ko before this one, please try to catch it because it's very, very important to know, hindi lang skin irritation ang pwedeng side effects ng mga lightening creams containing mercury, but it can also be systemic. So dun sa mga merong dark underarms, don't worry because we have a lot of safe and effective treatments already. Ang importante lang is to choose treatments that respect the sensitivity of this area and those that target the cause of pigmentation. And if you want long-lasting results, better pa rin talaga to seek the help of a professional and an expert in skin like a board-certified dermatologist. So guys, if you like this video, if you found it informative and helpful, and sa tingin nyo nasagot na yung mga katanungan nyo about dark underarms, please don't hesitate to hit the like and subscribe button and turn on notifications. Para naman alam nyo kung kailan na naman yung next video ko that can answer your most common skin questions. So with that, I end this video and I'll see you again next time. Bye!